right, so I wanted to talk about abdominoplasty, or what is more commonly known as a tummy tuck. In most cases, patients that come in for a tummy tuck have had children, they have some extra skin on their abdomen, they have stretch marks, their muscles are stretched out, and so it bothers them. They tend to be fit, they work out, and no matter what they do, they can't get rid of that extra skin, those stretch marks, or the separation of the muscle. There are other patients that lose a lot of weight through diet and exercise changes, or with gastric surgery where they have tremendous weight loss. And so all different types of patients come in. And so when you do tummy tuck surgery, what you are typically doing is you make an incision and you go from hip to hip. And the area in red, you basically remove all of that skin and fat. And then you undermine up to the base of the rib cage. And after you do that, you look at the muscles on the belly wall. And anyone that has had children, who has been heavy, tends to have what's called a rectus diastasis. And that basically just means that the muscles separated apart. And one of the most important parts of a tummy tuck operation is to repair that muscle. It's also the painful part of that operation. And so when I do a tummy tuck, I use a medication called Exparel. And Exparel is a long-acting numbing medication that you can inject on the belly wall where the nerves are coming out. And what it does is it lasts for about 3 to 4 days. And usually, with a tummy tuck operation, the pain, you can have 8 out of 10 pain. It usually brings that down to more of about a 4 out of 5. And so, using Exparel and doing those nerve blocks, what are called a tap block, is very, very important as far as making the recovery better and faster. Now, when I do tummy tucks, I do typically what's called a drainless tummy tuck. And the reason I can do that is I do what are called progressive tension sutures. And basically what that means is when you do the tummy tuck operation, you lift all that tissue up and then you bring it down, you end up with a scar down here. And historically, what plastic surgeons would do is they would lay a drain that would go in on either side, and it would drain inflammatory fluid that would otherwise build up in there. When I do a tummy tuck now, I put all these plicating sutures on the belly wall, and what it does is really 3 things. It makes it so that you don't have to have a drain. It takes tension off the closure, so the scar tends to be a lot nicer, and it allows you to contour the belly in a way that we couldn't contour before when we were just using the drains and we were not using the progressive tension sutures. The other thing you have to talk about with abdominoplasty is what are called DVTs or PEs. So that stands for deep venous thrombosis or pulmonary embolus. And whenever I do this operation, I do a risk assessment called a Caprini risk assessment, and it looks at your risk of blood clots. And of all operations we do in plastic surgery, tummy tucks have one of the highest rate of blood clots. And so in certain situations, I will put patients on a blood thinner for a week or 2 post-operatively. If they're low risk, I want everyone to use compression socks for about 2 weeks, and it's very important to get up and move around after this operation. There's a couple of things that I think are really important when you're doing an abdominoplasty. And when you design that scar, you want that scar to be very low so that when the patient is wearing a bikini or underwear, that scar is hidden underneath that. And so in this patient, you can see she had twins, and she had quite a bit of separation of those muscles on the belly wall. So we repaired that, what's called the rectus diastasis. And when I did it, I keep that scar very low. It's one of my biggest pet peeves when I see tummy tuck scars that are high. I mean, ultimately, when you have a tummy tuck, you want to be able to wear a bikini or hide that scar as much as possible. And then the belly buttons. I spend a lot of time on belly buttons to try to make it sure it looks like a belly button and that scar is very hidden. A lot of times you see tummy tucks and the scar is very wide. And so, again, a low scar, making sure the belly button looks like a belly button, and then using what I call those progressive tension sutures to try to give the belly a very nice shape and contour. And if you look at this patient from the side, you can see how she has a nice shape and contour, and again that scar is nice and low, and if you look from the other direction, nice and flat. And before the advent of progressive tension sutures, you're never able to get that. With abdominoplasties, it's really important to talk about the recovery. Of all operations we do, I think it tends to be one of the most uncomfortable operations. And the nerve blocks and the Exparel that I use definitely help with that. But I think one of the biggest mistakes that patients make is they underestimate the recovery associated with the operation. And so for about 2 weeks, you're definitely going to need to be off of work. And I've done this operation on a lot of my nurses, employees, etc. And they all took 2 weeks off. They came back to work at 2 weeks, but they're still very, very sore. And so, depending on your work, if you have a desk-based job, you could go back to work at 2 weeks. You'll still be uncomfortable. If you're doing more physical work, you might need some more time off. And for the first 6 weeks, I don't want patients doing much more than walking and very gentle exercise. And I certainly don't want them doing any heavy lifting for about 6 weeks. And one of the things you worry about is tearing those sutures that are plicating the muscles on the belly wall. Abdominoplasty or tummy tuck surgery takes about 2 to 3 hours, depending on whether you're doing more or less liposuction. Again, I don't usually use drains. I do what's called a drainless tummy tuck. When you wake up from surgery, you have an abdominal binder on, and the abdominal binder is going to be your friend for about 6 weeks. So the first 2 weeks, you're going to have that abdominal binder on most of the time. After that, I have people buy some Spanx or compression garments, and then I have them use those for about 6 weeks. And a lot of patients will like to use them even for up to about 3 months. It takes about 3 months before most patients are feeling kind of quote unquote more normal. And when you do the operation, you'll have an area of numbness on your lower belly that goes from about the belly button down to the pubic area. And over time that gets better and better and better, but that takes a long time to fully go away. So risks of abdominoplasty surgery are, bleeding. If it happens in the first 24 hours. Infection risk is very low. Wound healing problems. If you run into wound healing problems, it's usually the belly button. And patients that have had umbilical hernia repairs or previous surgery have a little bit higher risk of that. Generally, if the belly button has trouble healing, it'll heal in over time, can take a number of weeks. The abdominoplasty flap itself, if you have wound healing issues, it tends to be on the lower incision. Contour irregularities. We try to aim for perfection when you do the operation, but it's normal to have a little bit of contour irregularity from right to left. And then the scar. You have to be willing to accept the scar. And again, I always try to keep that scar as low as possible so that it is hidden in a bathing suit or underwear. And blood clots, and we talked about blood clots, the deep venous thrombosis or pulmonary embolus. Very important to get up and move after this operation. Use compression socks, and if I prescribe a blood thinner, make sure you're using that. And the anesthetic risk, so nausea, vomiting, 1 in 4 people get that with surgery. And with tummy tuck surgery, just, the recovery. There is definitely some recovery associated with it, but the operation does something that nothing else does. It gets rid of all that extra skin, all of those stretch marks. It tightens the muscles in the belly, and so patients are very happy with the operation.